Hi everyone, I'm Dr. Johanna Kremberg with Grand Prix Equine. I'm here with my technician Ella Littlefield, and this is Theo, our patient for today. And I wanted to go over a little bit with you what it means when we come for our spring visit. And we'd like to start to explain that the spring visit is more than just our spring shots. It's really our opportunity to take a look at your horse, and it may be the only time that we have to touch your horse each year or for 6 months from now. So we wanted to go over something that we've implemented recently to do a full physical exam before we do your horse's inoculations for the spring. And today I just wanted to go over what the exam will encompass, as well as the conditions that may arise or might show up with this exam that we wouldn't have otherwise found out if we just came to do your horse's inoculations. So first I'd just like to take a quick look in your horse's eyes, make sure that both of their pupils constrict with light, and make sure that there's no obvious external abnormalities with the eye. And then I just make sure that they blink when I come at them. That's called a menace response, and it just dictates to me that the horse is visual in both eyes. I take a look at their teeth. Maybe we are aging them after seeing them, not seeing them previously. And then I use my light again to take a look inside their molars and assess their molar health. Not every horse is happy about this. Good. And assess if they're due for a float, or if they've been floated recently, or if there's any other things that we should look at inside their mouth. Next, I take a brief listen to their heart. When we're listening to their heart, we're listening for arrhythmias as well as heart murmurs. And I not only take a heart rate, but I also listen to look at their breathing and get a respiratory rate at the same time. And then after that, I take their temperature rectally. And I talk to the owner a little bit about what concerns they may have. If there's anything that's changed in their horse in the last year, their body condition has changed, their skin has changed, or what their plans are for the upcoming year. Excellent. So now that he has a normal temperature, I feel comfortable giving him his inoculations. In the past, I found that without doing this exam, I was missing horses that had changes in their vision throughout the year. I was missing horses that had changes in their, an arrhythmia or a cardiac abnormality. I was also finding that some horses may be spiking a fever or a low-grade fever the day that we come to do their vaccines, something that we would definitely want to know, just like you or I, if you're going to the doctor. And then I also talk with the owner a little bit, if there's any sort of orthopedic issues that we've been addressing, or if there's any sort of scratches or just dermatologic issues that we've been going over or need to be addressed at this time. So that's just a brief review of the wellness exam, and Theo looks to be in excellent health.